Welcome to Dhaka Tribune presents Straight Talk, one-on-one conversations with newsmakers and opinion shapers. I'm Dhaka Tribune editor Zafar Sobhan, and I'm in conversation today with Dr. Tarek Alam. Dr. Alam, welcome to the show, and thank you for being here.
Thank you very much for having me. Thank you.
Okay. Dr. Alam is head of medicine at Bangladesh Medical College and Hospital, and of course is well known perhaps to many of you in the viewing audience today for his breakthrough in the treatment of the COVID-19 virus. Dr. Alam, can you tell us a little bit about the protocol which you have developed with your team at BMC, and also tell us a little bit about what your findings have been in the few months that you have been operating with it?
Oh, thank you very much. I have been using a combination of an antiparasitic drug named ivermectin and antibiotic doxycycline, which has been, both of these have been around for last 35 to 40 years. And this protocol, what I'm doing now is I'm giving them ivermectin as a single dose and doxycycline very low dose for 10 days, which they usually have been having for other ailments they're indicated for. Up till now, I've treated about 600 patients, most of them over telephone with their consent, certainly, that they want to have this medication, as there is a lot of bickering that this is an antiparasitic medication, not usually an antiviral medication, but we're repurposing the medication now for antiviral activity, which has been shown in a laboratory at Monash University in Australia. And came out
that's right. Other people have also used ivermectin, but I think what's different with yours is ivermectin plus doxycycline. Is that correct?
That's right. That's right.
Now, tell us a little bit. You earlier you shared with me a paper you're working on where you talked about the scientific basis for the treatment and how and why this combination of drugs, as you mentioned, is ivermectin is an antiparasitic drug, so the people don't necessarily see the connection, the obvious connection between why you would use a drug such as that to treat something such as the COVID-19 virus. But if you could share perhaps the contents of, in layman's language of what's in the paper with our audience, I think that would be very interesting to them.
Ivermectin has been used previously in the SARS epidemic and in the Zika virus epidemic in Thailand, and also in dengue. So it has as an antiviral medication. And this time in Australia, they used it on the SARS-CoV-19 virus, and they saw that within 48 hours the virus almost vanished in the lab. And doxycycline is an antibiotic. It has antiviral activity, proven in has in many articles in pharmacology, and so that was a good combination. That's what I thought, and it also as an antibiotic because the virus can cause secondary infection. So the combination was thought out as going to be a good, promising treatment for SARS-CoV.
Okay, and so tell me then a little bit, you say you've treated over the last few months about 600 patients with this treatment. So typically, what have you found in terms of the response? Does the virus leave their body? Do they test negative very quickly? And, and how many of the 600 would you say are now virus free, and how long does it take typically?
Out of the 600 patients, we had given ivermectin and doxycycline. 97 to 98% patients are virus-free now, and they are asymptomatic. About 2% patients, that is about 10 to 12 patients, had to go to the hospital because they were started on the treatment late, and they had other comorbid conditions like diabetes, hypertension, and ischemic heart disease. And I have lost only one patient who died, who was sick in the beginning. So only one patient died, and around 12 went to the ICU, and 11 came out of it. So the results are really promising till now. The thing is that you have to give the medicine early. As soon as you test positive, if you can start the medication, then the results are really good.
Otherwise, so that's a very keen point in there. So that if it's, let's say someone has been carrying the symptoms for quite some time, and then they get themselves tested, but it's possible they at that point have had the symptoms for let's say 8 to 10 days, then you would expect it not to work as well. Is that, I suppose that would be correct? Yeah, and with comorbidities, that's also something which can be a complicating factor, or do you find?
That's right. With comorbidities, if this medication doesn't work that well, certainly. But if you can give early, I have gotten away with a few cases because I could start early. But most of the time, the patients with comorbidity come late actually, and at that time you need admission to the hospital, and then you need steroids, the other medications, remdesivir, and tocilizumab. Those medications are really needed at that time because when the cytokine storm starts, ivermectin cannot stop it.
Okay, I see. Well, how would you respond to critics or commentators who would say, well, you know, most people who have COVID-19, the vast majority of them will, in fact, get better in any event, even without any medical intervention. And so, for instance, if you're saying, well, you know, you've given it to 600 people and 98% of the people are getting better, but there's still about 2% of them who do not, and you've had 12 patients who ended up at the ICU. Is it possible that, you know, that's largely a function of, you know, the way the numbers of the virus in any event?
It's possible, but usually the numbers are 80% will get better, 20% will get sick, and out of this 20%, around 5% will end in ICU. So here, if patients who have gotten the medication, only 2% have ended up in ICU. Okay. And only 1% died. That's
So you're saying that the numbers are considerably better than what one would imagine, one would see without any treatment. So it's okay. So let me try to do the math here. So it's like, so it's typically 5% in the ICU, and you've ended up with something closer to 2%. 12 out of 600 is 2%. So that's a significant difference. And then you had unfortunately, of course, one person. We've lost the lives of one patient, but again, out of 600, that's probably better than the average. Do you have any clinical trial based on this? I mean, I think that's the ultimate way of convincing the skeptics that this is in fact the solution. This is in fact a cure which actually works. Where do things stand in terms of doing a clinical trial with ivermectin and doxycycline?
Our team we have applied to BMRC for a trial. It's almost ready. There are a few nuances which has to be taken care of. We have submitted, corrected those things, and this is a possibility. Most likely we'll get permission next week. And my colleagues at ICTDRB, they're doing a trial on ivermectin, and IEDCR, Dr. Mirjadi Sabrina Flora is also doing a trial on this at the hospital. And they also did a trial on this from CDC in Cox's Bazar. This trial was done with a combination of ivermectin doxycycline versus hydroxychloroquine and azithromycin, and they also got very good results. They have submitted it to CDC in the USA. So the paper hasn't come out yet, but the results were good.
Okay. And what about I think Monash University, you mentioned that earlier in our conversation. Is that a clinical trial, or is that just the findings of
that's a lab trial?
That's a lab trial.
Lab experiment. What they did there, they're on human cells, live cells. They put the virus, and then they put the solution of ivermectin, and then they check the viral load in 48 hours and 72 hours.
Okay. Now, where do things stand in the international medical establishment with respect to ivermectin as a possible treatment for COVID-19? What does the WHO and other sort of international, transnational health organizations, what is their position on this? What's the latest?
Internationally, there are 16 trials going on all around the world. Number one is in Johns Hopkins. They're doing it also. And in almost all continents, they're doing a trial with ivermectin. And actually, the dose has to be decided. What dose will work? Whether the single will work, or we need to have more dose, because in the lab at Monash, the dose was very high. And I have given a very small dose, which we usually use for scabies or head lice infestation. So the trials are to decide the dose. And the other thing is, they have been using it in India also. In Bombay, they're using the medication, the protocol. In Calcutta, they're using this protocol. and they are having good results there because it is the medication, it's a cheap medication, and you can straight away operate. It doesn't have that many almost nil side effects. I haven't had any side effects yet in any of the patients who got ivermectin and doxycycline. So I think and WHO is also thinking to have one of their arms. They were doing the solidarity trial. So one of the arms was hydroxychloroquine and azithromycin. So they stopped that trial, and they are thinking of adding ivermectin in that trial also.
I see. Now, one of the criticisms I think you might have heard is the use of doxycycline, because a lot of people will say that use of an antibiotic for people at the early stage of the illness is probably, there's been some pushback on that. They say that, well, of course, there's evidence that people who get severely ill and probably then at that point they should take antibiotics. But I've heard some pushback in terms of giving people antibiotics right at the start, especially considering this is not really sort of a bacterial infection. So what would your response to that be, sir?
My response is doxycycline is an antibiotic, certainly, but it has antiviral effect. And it is also used to stop the cytokine storm. Okay, it has some immunomodulatory effect. That's why I have used it. But let me ask a question actually to you. So we didn't question using azithromycin with hydroxychloroquine. Azithromycin was also used at that time, but we were using it blindly, and which killed a lot of people.
Yes.
Both of medications were cardiotoxic, but there was no question, no studies at that time, that we were using it blindly everywhere, in Bangladesh also. But at that time, no questions rose because the president was taking it.
That's right. Yes, indeed. Yeah. No, absolutely. So, I mean, I think this is the thing. You see, I mean, these things have to be done very with a great deal of responsibility. And you see, and I think there was a lot of concern and panic out there, you see, and so people have been taking all kinds of things. I mean, I think we're fortunate that people weren't swallowing bleach if we're talking about the recommendations of the US president, you see, because he came up with some very outlandish ideas. But no, I mean, I see what you're saying. Could you circle back a little, because you talked a little bit about the scientific properties, but if you could just perhaps expand on that a little in terms of how the combination of the drugs actually works in your assessment, in terms of, how it affects, I think it's the parasitic wall. If I looked through the paper, but not being a medical professional or scientist myself, it may have been a little above my pay grade. But if you could explain that to the audience, it would be very helpful.
There's a preprint version that came out from New Delhi. One of the scientists of the Bhabha Atomic Research Center, which is the #1 research center in India. This guy, Dr. Dharmendra, is an assistant professor there. He did a study after he saw that we have been using ivermectin and doxycycline successfully in Bangladesh. He did a study whether it works molecularly or not. So he has this preprint paper I sent it to you. This paper shows that ivermectin and doxycycline both covers the viral and spikes, the spike proteins, which usually causes the cytokine response and the infection and the DIC and the lung problems. And both of them has a very good antiviral effect. So this thing, I think, when it comes out as a published paper, I think it will support me, and the combination have started.
Okay, I see. And let's get back a little to it. Where did you get the idea? You mentioned that, of course, ivermectin has been used for SARS, for Zika virus, for dengue. So it does, it's not unheard of. It's not unprecedented to use it for such a process. But where did you get that idea from initially? And what made you think in terms that doxycycline may be a useful adjunct to just using ivermectin by itself? What was what moved you in that direction?
Okay, the using of ivermectin, the idea came from the Australian study that ivermectin kills the virus. So it is available in Bangladesh. I was waiting for a patient because in Bangladesh Medical College we don't have that. We didn't have that COVID patients at that time. So I was waiting to use ivermectin, and doxycycline had been used in US nursing homes where they wanted to avoid the cardiotoxicity of azithromycin in COVID patients. So there, my friend was also working on it, but he was doing only doxycycline, nothing else. So at that time, one of the colleagues, a senior colleague, I told you this story again and again. A senior colleague who came, he was COVID positive, and he didn't want to have azithromycin doxycycline in fear of cardiac toxicity. So at that time, both of these medications were in my mind, on my mind. So I told her that I could give it if she wants to try it. Both were not tried any before, and she agreed. And that's how it began. And then she tested negative in 7 days. She didn't have any more symptoms. She had comorbid things, diabetes, hypertension, all these things. But the results were okay. So after that, these things clicked, and then I started giving to my students.
Okay. And would you recommend, I mean, as a doctor, so for instance, if anyone does test positive and they can be fairly certain, due to, the symptoms or lack of symptoms that is early on in the infection for them, would you recommend everyone would take this protocol from a precautionary standpoint, or would you say it should be only for certain populations or people who have a certain level of the virus? How would you advise people on that?
If the patient is young, and doesn't have any comorbid status, he or she most likely will come out of it without any medication, with just the supportive zinc, vitamin C, and vitamin D. Okay, but if the patient has comorbid status like diabetes, hypertension, ischemic heart disease, and is a little bit elderly, I would suggest them to take the medication if the test is positive, because it is nice to hear that 80% gets better, 20% will get sick. But if you make it a small block, out of 4, 1 is going to get sick. 20%. Okay, so who is going to be that number 5th? You don't know.
Right.
And we are having in Bangladesh young patients who are getting lung problems and stroke and dying. So in that scenario, it's difficult to say that who is going to benefit, who is not going to benefit. But I will certainly give the option to the patient, and if he or she agrees, because it is still an experimental medication, we don't have a research protocol passed yet. So, and if they agree, they can take it with the consent.
Okay. Out of your 600 patients, what is the age spread in them? Do you typically tend towards patients who are above a certain age, or is it all levels of the population?
The age span is actually 8 to 65 or 67, something like that.
Okay. And you mentioned that 12 of them have ended up in the ICU. Again, how does that break up in terms of age? Have you found that is it the older the person is? Because of course, this is the people around the world, more so around the world, but to some extent still in Bangladesh, people above the age of 60, above the age of 70, above the age of 80 are the ones who are most vulnerable to this virus. So the 12 people who've gone to the ICU, are they patients of advanced stage, if you could share that?
Well, there were actually 5 patients after this year. 5 were young, around 45.
Okay.
5 were around 45. They didn't have any comorbid diseases. And the other 7 were old and had diabetes and ischemic heart disease.
I see. Yeah. So I mean, this is it. I mean, I think this is the scary thing about this virus. The numbers on the one hand seem very, they seem positive, especially if you're young and if you're in good health. You can say, well, I'm very unlikely to be one of the unlucky people who gets sick and needs to go to the ICU. But then you can never tell. It's really a roll of the dice, and who wants to take a chance? Because, like I said, it could be only a few percentage, but if you're in those few percentage, well, you could be.
Yes, that's right.
Yeah. Now, my question is, I know a lot of people, a certain number of people of my acquaintance who've been sick have actually also taken your protocol medication, but without actually consulting with you or even perhaps with any supervising doctor. So how would you sort of suggest people go ahead with this? Because you can't obviously, not everyone can consult with you, not everyone can consult with your team, but are there other doctors here in Bangladesh who people could consult with, who could, I presume, if people are going to take this protocol, it should be overseen by a doctor?
You're right, it should be overseen by a doctor. And from the beginning, I've been telling that if you're not positive, don't take the medication. And if you have to take the medication to really sick, you cannot test because of the problem, scarcity of testing, then you should at least talk to the doctor who will decide what medication you should take. So I'm not at ease that everyone is prescribing, but I know lots of doctors all over Bangladesh have been prescribing, and they have modified also a little bit
Okay.
the so.
And are you in touch with a lot of these doctors? Do they talk to you and share their findings with you, or seek your advice and guidance?
Maybe a few. Maybe a few
Okay.
that we can count, but not all of them. It's not possible for them to talk to me also.
Sure,
so,
yeah.
But I know I have seen a lot of prescriptions online. I have never put a protocol online because I don't have a Facebook account. So, but
Right.
whoever has taken medication from me has talked with me, and I've given them.
Okay, good. Now let me switch up a little, and one of the things which has been surprising to some extent to us here in Bangladesh is, I think, when the virus, when we had the first case, which was on March 8th, and then we had the first death, which was March 18th. And then, if you looked at the numbers in other countries, one would have imagined that now we're sitting here as the 22nd of July. It's several months later. And, things haven't been as bad as we feared here in Bangladesh. Why do you suppose that is? Do you have any, is it to do with the youth of the population? Is it to do with other factors? What do you think may be, or may account for this somewhat anomalous result we so far seem to have had here in Bangladesh over the last 3 or 4 months?
It's very difficult to say. Age, maybe you're right. Age is one of the things that the majority of people are young. That's a possibility. And the other thing is, I don't know actually. The virus is losing its potency or not. But one thing strikes my mind, whether people have taken ivermectin or not blindly.
Yeah, that could be it.
They have taken ivermectin with a little bit of fever. Maybe it was a simple flu. They took ivermectin or was prescribed ivermectin. So that is a small possibility. But I think the age of the patient, most of the patients, is the main cause that we have a sanitized result here.
Yeah. Could it be, who knows? I don't know. Could it be something to do with diet? Could it be? And it's interesting, you see, because if you look at the US, for instance, you're seeing it among lower income people more. Okay, and you're also seeing it in certain minority communities more, and I think you're seeing the same thing in the UK. Whereas in Bangladesh, I don't know, I haven't really seen statistics. I've tried to get them about the 2,000 odd people who have died so far. What sort of socioeconomic background are they from? We've got the age distribution, but beyond that, it's very difficult to get the other statistics. But it certainly seems to some extent as though you're getting people from all levels of society. Certainly many prominent people who are well known, who are well known to everyone in Bangladesh, in fact, have very sadly, very tragically been stricken by the virus and passed away. And certainly anecdotally, at least, it seems as though it has not spared people, in the middle classes, the upper middle classes. So it's so then it occurs to me, a lot of people said, well, one of the comorbidities is to you have stuff like diabetes, hypertension, heart disease. And in a country like the US, comorbidities like that are generally seen more in people of lower income. But perhaps in Bangladesh, they're seen more of people with higher income, because it's people of a higher income in Bangladesh who have diabetes, who have a poor diet, who eat lots of meat, who eat lots of red meat. Perhaps could that be part of the answer, that perhaps people of a lower socioeconomic strata of society have better diets and actually live in some ways healthier lives than people of more middle class, upper middle class backgrounds?
Well, if you look at Bangladesh, the people from lower socioeconomic group, they're not that much sick. They're not ending up in the hospital.
Exactly. If you look at, let's say, Koral Bosti, to take one example, there have been no deaths from the Bosti, and very few infections, in fact.
And if you look at the lower socioeconomic group in Bombay, there is a big slum there. People are dying there right and left.
Exactly.
And we are of the same region, same genetics, everything is here. So there is some kind of protection here, and most likely it's coming from lots of infections through all of these years. Most likely there's some kind of innate immunity we have. I would advise, actually, the scientist we have, I'm not a scientist, I'm a clinical doctor, if they could take the blood samples from these people and see what they have, I think that could make a lot of difference. why they are not having the infection. That is the point actually place where we should go without doing anything further big research. Their blood should be checked. Why they are not having the infection? They are living in such tiny spaces. They're not wearing masks, and they're working everywhere, going everywhere. Their sanitation is not that good. So there has to be something that is giving them immunity. So there is no death, no sickness, nothing. So I think the government, the Ministry of Health, should give some kind of attention at this part and find out that maybe we could find a new cure for COVID from there.
Okay, we have, let's see, we have a couple of questions. We only have a few minutes left, but maybe we could try seeing questions from the audience. If you could share them on the screen, and
Yes.
then Dr. Alam could take a look. So now we got, so can doxycycline and ivermectin combination given at an early stage prevent severe COVID-19 infection, even in elderly people with underlying health complications?
It's a possibility. It's a possibility that it can prevent severe infection. The problem is no one can stop the cytokine immune response. So that's the problem. If you can give it early, if we keep an eye that when the patient's oxygen is not going down, and keep the patient as we're supposed to have in a prone position, and take care of the other infections if needed, give extra antibiotics, then there is a possibility we can stop having severe health complications.
Okay, super, thank you. We got one more question. Oh, what's this? I was looking at another one actually, but we can go with this one. This is a rather long compound question, but what are some of the precautionary medications people should be taking now? So you mentioned zinc and vitamin C, so if you could speak a little bit about that. And at which point one should begin the medication recommended in your prescription that's making the rounds? I think you've answered that question. Are there side effects to taking ivermectin? That's a good question. And there's precautions for diabetes patients. And what should one do if you have one or two symptoms? So
can you show the question again so I can answer one more? The precautionary medicine taking now, yes, precautionary medicine people should be taking now is zinc, vitamin C, and vitamin D. And which point should one begin the medication recommended in your prescription that's making the rounds? After this test positive, at that point they should start the medication. They can start the medication if they want. Side effects of ivermectin, yes, there are side effects of any medication that is available. And for ivermectin, it's very, very, very rare. And you can have skin rash, a little bit of nausea sometimes, and vomiting, gastric upset. Those I haven't seen any rash or anything. What are some precautionary measures diabetes patients should take? They should control their sugar very much and avoid patients or exposure to patients who have COVID. Can you give us a breakdown of what one should do when they have one or two symptoms? Break down one or two symptoms, you should at least consult a doctor. Maybe you should start, maybe you should put yourself in isolation. And then if 3-4 days you're still having the symptoms, then you should go for a test for the virus.
Okay. And I think we have time for one last question, if we could. Yes, so as far as clinical interventions protocol is concerned, is there any standard procedure being developed in Bangladesh for COVID medical practitioners to follow? Is it everyone's kind of freelancing and doing what they think is best?
No, clinical intervention, no, it's not freelancing. It's not going to be freelancing anyway. We are trying to develop a clinical protocol how to treat COVID patients early, and ICTW is trying to do it. Dr. Sabrina Flora is trying to do it. My BMRC research protocol is approved. I'm going to also try to do it, bring up a new protocol.
Well, I think we must be doing something, right? Because as you say, at the end of the day, the proof of the pudding is in the eating. And we have, certainly, of course, 2,000 plus deaths is always a tragedy. And we have tens of thousands of people who have been stricken. But if you look at the numbers, even next door in India, as you had mentioned, let alone countries like the UK, Brazil, and the US, Bangladesh seems, relatively speaking, to be quite blessed. And certainly much of the credit and thanks must go to our medical practitioners. I'm quite sure for that. Anyway, Dr. Alam, thank you so much. It's been a very educational, informative, and eye-opening conversation. Thank you for giving us this time. And thank you for all the work you're doing. Keep it up. And I hope very soon that your clinical trials will get started, and then hopefully the whole world will be able to know about the good work you're doing here in Bangladesh and what you've been able to do for Bangladeshis here with the COVID-19 virus. Maybe that's a service that can be shared and spread over the world as well.
Thank you very much, sir. Thank you very much.
Okay. And thank you for tuning in. This has been Straight Talk with Zafar Sobhan. My guest tonight was Dr. Tarek Alam, who's the head of medicine at Bangladesh Medical College Hospital. And please join us again next week. Join me again next week, same time, 9 p.m. Wednesday. Thank you very much.
You're welcome. Thank you. Good night.